NCS 3201 Professional Capacity Building. Assignment 1 Professional Development Plan. Justine Cruz 10332213.
Good morning, good evening, or good afternoon to the viewers of my presentation. Today I will be presenting my Professional Capacity Building presentation. The purpose of this presentation is to address achievable goals to further develop my nursing career and to help myself achieve optimal outcomes using the format of a professional development plan for the next 5 years. I will be talking about my dream job and the reasons why I have chosen this particular career path. To demonstrate self-awareness and proactivity, I will be using a SWOT analysis. I have 5 set SMART goals that are in accordance with an NMBA competency standards. I will then identify 5 pieces of literature relevant to my chosen career that I will use for writing a report to present my findings. I have included a reference page to allow the viewer to assess my resources used. Dream job. So my dream job is to become an emergency clinical nurse. The reason why I have chosen this is because I enjoy a challenge with the variety and complexity of patients. I enjoy the fast-paced environment with a quick turnover of patients. I also enjoy working in a close team with doctors and developing good relationships with healthcare team. I also enjoy the fact that every day is different. A brief summary of duties that emergency clinical nurses must adhere to within the clinical setting are that they provide comprehensive evidence-based nursing care and individual case management to a specific group. These include assessment, intervention, and evaluation. They must participate in ward rounds and case conferences, educate patients and carers in post-discharge management, and organizes discharge summaries or referrals to other services, supports and liaises with patients, carers, colleagues, medical, nursing, allied health support team, external agency, and the private sector to provide coordinated multidisciplinary care, completes clinical documentation and undertakes other administrative and management tasks, monitors and maintains availability of consumable stock, promotes and participates in team building and decision making, also responsible for the clinical supervision of nurses at level 1 and or enrolled nurses or assistants in nursing. Education, training, or research duties include engaging in continuing professional development and education and ensures continuous registration, undertakes supervision and development of undergraduate nursing students, plans, develops, and implements education programs for patients, colleagues, and consumers, participates in evidence-based clinical research activities where applicable. The South Metropolitan Health Service governance, safety, and quality requirements, undertakes performance development review of staff under their supervision, fulfills the National Safety and Quality Health Service standards requirements, which include audits, reviews, and drills that result in improvements of patient care, staff knowledge, and consumer experience, and to undertake other duties as directed. The essential selection criteria are eligible for registration in the category of registered nurse by the Australian Nursing and Midwifery Board, demonstrated advanced clinical knowledge and experience in delivery of evidence-based nursing care within the practice setting or specialty, demonstrated high-level interpersonal negotiation and conflict resolution skills, ability to plan and conduct patient and staff education, demonstrated ability in the development, implementation, and evaluation of new and existing policies, procedures, and programs, current knowledge of legislation obligations for equal opportunity, disability services, and occupational health and safety, and how these impact on employment and service delivery. Desirable selection criteria would be post-registration qualification in the area of specialty or evidence of significant progress towards one, knowledge of current clinical governance systems, and experience within the pediatric emergency department. So career requirements include a degree level of completion of master degree or postgraduate certificate, a license. All state requires license for registered nurses, certification and experience. Clinical nurse specialists can obtain certification in some advanced practice specialties. Also, most employers prefer at least 2 years work experience. Key skills include leadership, teaching, research, written and verbal communication, good knowledge and good understanding of medical equipment related to the specialty, basic word processing, and the median salary for registered nursing sits at $66,640 as of 2014. The steps I will be taking to get to this position will be: first, to earn a bachelor's degree in nursing, obtain a state license as a registered nurse, gain experience. Most CNS graduate degree programs require applicants to have gained experience as an RN in the specialty they have chosen. Generally, schools require 1 to 2 years direct patient experience in a clinical setting. This experience can be attained by performing RN nursing duties in hospitals, outpatient settings, or private practices. My next step would be to earn a clinical nurse specialist master's degree from an accredited program. Master degree programs for clinical nurse specialists generally take 2 to 3 years to complete, depending on the specialty. And my final step would be to apply for certification if the chosen area requires one. SWOT analysis. What is a SWOT analysis? According to Adams and Allred, a SWOT analysis is a personal assessment tool formed to raise self-awareness to individuals. SWOT is an acronym used to identify an individual's strengths, weaknesses, opportunities, and threats. The strengths that I have identified are receiving a graduate program at Fiona Stanley Hospital in the Emergency and Acute Medical Care Unit, anticipated completion of my bachelor's degree in science nursing, 2 years of clinical practicum experience at Royal Perth Hospital. These included general medical, neurosurgery, orthopedics, acute medical unit, acute surgical unit, and emergency. I am also an Australian Nursing Federation member, therefore I have access to resources and online assessments. Strong points within my personality are that I'm determined, friendly, approachable, organized, multitasking, creative abilities, interpersonal communication, and problem solving. My source of motivation and inspiration is my family. The weaknesses that I have identified would be, after exposure to the emergency ward, I realized there's still so much I need to learn about nursing, and especially emergency nursing. I realized I need to network more effectively. The difficulties that I'm facing right now would be my assignments, my personal life, and I feel financially vulnerable. I also need to be more confident in myself. Opportunities that have been available to me would be entry into the Fiona Stanley Nursing Undergraduate Residency Transition Program in acute medical care and emergency. However, if I was unsuccessful in securing a position into the program, I would have applied to many more hospitals and GP clinics. However, with so many hospitals opening up, I feel entry into the NURT program will create a wonderful stepping stone to my nursing career. Opportunities available through the demographics, with the opening of the new Midland Hospital and the soon construction of the new Children's Hospital, I feel that there's going to be a lot of job opportunities opening up. I also have access to technology, so the ANF website, YouTube, and the podcast. Currently, I'm listening to a podcast called Crash Cart, which is all about emergency nursing. I also enjoy working in the public health sector. I have also worked with so many different personalities. I feel prepared to encounter the difficult people I have to work with, including patients and co-workers. I also enjoy emergency nursing as well as ward nursing. However, I would like to experience theater nursing sometime in the future. The threats that I have identified would be Fiona Stanley. With so much negative media coverage, even now as a student telling people I have a graduate program at Fiona Stanley, they always have something to say about the hospital. I understand that nursing is physically and emotionally demanding. And my skills. Having experienced an emergency ward, I know that there's so much I have to learn and go in depth into. I feel research and constant re-education will keep me up to date and safe in my nursing practice. Currently, I feel that I am being exposed to many financial threats at this very moment. Also, my travel from work, I live in Midland, which is 40 minutes away from Fiona Stanley. Next year, I need to consider moving houses. Unfortunately, I cannot right now as I'm living in a Homes West home, and to request to move houses may take up to 2 years. Goals. A SMART goal is defined as one that is specific, measurable, achievable, results-focused, and time-bound. Specific. Goals should be simplistically written and clearly define what you are going to do. Measurable. Goals should be measurable so that you have tangible evidence that you have accomplished the goal. Achievable. Goals should be achievable. They should stretch you slightly so you feel challenged, but defined well enough so that you can achieve them. Results-focused. Goals should measure outcomes, not activities. Time-bound. Goals should be linked to a time frame that creates a practical sense of urgency or results in tension between the current reality and the vision of the goal. Without this tension, the goal is unlikely to produce a relevant outcome. The goals that I have chosen are: Goal 1. To complete and graduate undergraduate bachelor's science of nursing by the end of 2015. Goal 2. To be confident with public presentations by the end of 2020. Goal 3. To complete a postgraduate course in clinical nursing by the end of 2002. Goal 4. To build on my clinical skills by attending or completing education and courses by the end of 2017. And Goal 5. To improve my legal documentation skills by the end of 2016. The 5 pieces of literature I have chosen are: Literature 1, Emergency Nurse Residency Program Evaluation. This is a mixed method descriptive study to perform an evaluation of an emergency nurse residency program. Literature 2, Moral Distress in Emergency Nurses. Using a qualitative cross-sectional and descriptive design, this article assesses the frequency, intensity, and type of moral distress found in 51 emergency nurses working in one community hospital. Literature 3, Resiliency in Emergency Nurses. The aim of this study is to explore the resiliency characteristics exhibited by emergency nurses as well as experiences. Literature 4, Relationship between empathy and well-being among emergency nurses. This article uses cross-sectional descriptive correlative designed to better understand the shortfalls in pain management by considering nursing characteristics. Literature 5. Registered nurse's perspective on the new graduate working in the emergency department or critical care unit. This is a qualitative study used to assess a registered nurse's perspective on work relationships with new graduates within the emergency and critical care setting. To conclude my presentation, my dream job is to become an emergency clinical nurse. Using the format of the SWOT analysis, I have used a self-evaluation tool to personally reflect on my strengths, weaknesses, opportunities, and threats. I have laid out 5 specific, measurable, achievable, relevant, timely goals. 5 pieces of literature that will be used to perform a literature review. With the increase of hospitals opening in WA, I feel there's many opportunities for me to further develop my nursing career and professional growth. Thank you.